Hi, I'll be talking about OCD today. I'm just going to leave that here in the comments. OCD. And let's see. Hi, Dr. Gairas. Hi, Mot Gahre Pavan. Hi, Preet Bahilani. Hi, Aman. Hi, Mindcare by Kirti. And we're just going to talk about OCD today a little bit until my little one comes barging in. I'm just trying to figure out how to put the topic here. Just 1 second, please. Feel free to drop in questions about OCD. I'm just figuring out how to put in the title of the topic, of the conversation. We're talking about OCD, and if you're not a mental health professional, I'm sure that you've at some point self-proclaimed diagnosed yourself with OCD. I know I had before I became a psychiatrist. But I figured, can I talk on autism? I really talk about autism for sure one of these days. I think it's another topic that needs a lot of awareness for parents, for individuals. So many of us know people who are on the spectrum, but we've never bothered to understand about autism. But we are today talking about OCD, and I'm a little under the weather. I have a wisdom tooth. I'm getting wiser, so I have a wisdom tooth issue going on, but still, I thought OCD is something that I get asked a lot about, and there have been a lot of questions, especially recently in my DM, asking specifically, can you talk about OCD? Since it's something that I deal with in day-to-day practice so much, I figured why not take out some time and talk about it. So I'm happy to answer any queries about OCD. Any of you think that they have OCD? Raise your hand. If you think you have OCD, raise your hand. A lot of us feel that we have OCD, and it's normal and natural to feel like that. But hi, Dr. Kathakali, how are you? Now, OCD, as you know, and it's quite famous, stands for Obsessive Compulsive Disorder. And we are here to kind of debunk some myths about OCD, since so much gets talked about OCD in a very generic way, and I put it in one of my posts recently that just that washing hands is not OCD, just cleaning isn't OCD, just tidying up everything isn't OCD, and people love to say that, oh my god, I'm so OCD, and no, you're not. That's not a D, that's not a disorder. So before I talk about the O and the C, let's talk about the D in the room, because just like how sadness doesn't mean depression, similarly just having things and liking things in a nice way doesn't mean that you have OCD. A disorder is something that affects your life, in various domains. Means that maybe day-to-day functioning becomes difficult, you can't enjoy your life anymore. Now it starts inhibiting your work, now it starts inhibiting your free personal time, it starts coming in the way of even just free time for that matter. That is what a disorder's definition is. So just like drinking once in a while doesn't mean that you have alcohol dependence. Similarly, being sad or being anxious on the stage doesn't mean that you have anxiety disorder. You may be facing anxiety, you may be sad, of course. Similarly, washing your hands is not OCD. Now, what are obsessions and what are compulsions? So let me break it down. Obsessions. So we all like to say, oh, I'm so obsessed with this. Like I like to say right now, I'm so obsessed with this cup. I like this cup. It's fine. I'm not obsessed with it. I don't carry it around with myself everywhere for sure. But we love using this word so loosely. So obsessions are actually something different. Now, let me define it and let me break it down for you, because there's something that I do in my practice. I believe knowledge is power, and just by empowering so many of my clients with what they're going through solves half the problem and helps them understand that what they're going through has a name, happens to other people. There is a solution for it. It's treatable or manageable, and that just changes the entire scenario. So obsessions are unwanted. First of all, unwanted. More on them, I will answer some of your questions. Thank you for putting them across. They're very good questions you're asking specific to OCD. But we're just here to help others who do not know what OCD is. First, understand what OCD is. So obsessions are unwanted. They're not nice. They're not something that I want. It's not like thinking about my vacation, where will I go when the exams get over. That's a thought I want, right? I want to think about it. They're unwanted, they're unpleasant. So they're usually not of a nice nature. And there could be thoughts. So there could be like words like, what if this happens? What if that? They could be images, so that you could just have images as such, or they could be impulses, the wish to do something. And they keep happening repetitively. So think of a broken record that it keeps on going again and again and again and again. And one important characteristic is that it causes a lot of disgust, it causes a lot of anxiety, it causes a lot of uneasiness, meaning that these thoughts are not nice to the degree that it makes you feel uncomfortable. And that is exactly what it is. It's not the sort of nice thought you get and you think, oh wow, I'm going to do this, I'm going to go there, I'm going to eat that. There is uneasiness tied up with this thought. So that is the core principle of an obsession. Now, since as humans we want to dispel our energy, the negative energy that we have, we do certain acts which counteracts the obsessions, and these are called compulsions. So compulsions are either actions or they're rituals or they're behaviors that we do to reduce the obsessions, or at least reduce the anxiety and the distress from the obsessions. So let me give you an example. For example, I feel that my cup is dirty, so I wash it once, because the idea of drinking from a dirty cup obviously makes me feel disgusted. I wash it and I look inside and I go like, okay, it's clean, but I can see a tiny speck. Let me wash it again. And then I look at it and I'm like, okay, wait, you know what? If it's dirty, then you know what will happen? I'll get germs and coronavirus can happen. And then, I can get sick. And what if somebody else in my family drinks from it? What if my child drinks from this mug? They'll fall sick too. Then we'll have to go to the hospital. Then such bad things will happen. Oh my God, this mug is dirty. It needs to be washed right now. So that's how the train of thought starts. So always, always, always remember that with obsessions and compulsions, there's a lot of anxiety. So since OCD used to be categorized as the anxiety disorder, it still is an ICD. There's always anxiety tied up with obsessions, meaning these unwanted thoughts have sort of a tangent, a mind of their own. It's a train which goes off on its own and you can't stop it. अब आप ऐसे पकड़ लीजिए that obsessions जो है are of many kinds and compulsions are also of many kinds. So most people think of obsessions of dirt and then they think of the compulsion of washing hands. Most people think of the obsession that things are not perfect and then they want to arrange it कि ये यहाँ रखा है, ये यहाँ रखा है, side by side होना चाहिए, perfect angle पे होना चाहिए, एकदम side by side. So if somebody moves your things, you'll go like, no, it needs to be kept perfectly. Certain people are in the obsession of what if my lock is undone, so they keep on checking. So the compulsion is checking. कुछ लोग गैस चेक करते रहते हैं, कुछ लोग दरवाज़ा चेक करते रहते हैं. In fact, one of my patients had this compulsion. He used to take the picture of his lock every day when he used to step out of the house. उसको लगता था कि मेरा lock खुला रह गया, so he used to make sure that he would take a picture. And his gallery was all filled up of just pictures of the lock that, timestamp, date, and that I've locked the door. That was the sort of, compulsion he had developed so much. But there are more obsessions. There are more compulsions, things that people don't talk enough about. And that's the one that I want to kind of address right now. Some of the obsessions are called things like magical thinking. Now, this is a specific thing which is fairly common, but people don't understand. Meaning, अगर मैं ऐसा नहीं करूँगा तो वैसा हो जाएगा. Meaning, if I don't lock this door X number of times, somebody that I love will die. Or that if I don't perform this particular action, maybe I'll lose my job. Now, this is more than superstition, mind you. A lot of people say, ये तो superstition है. But this is not superstition. This is something which becomes an obsession. And it causes so much distress and it's so egotistic and you cannot stop thinking about it, that if I don't step out of the house with my right foot first, then I will not come back, or that my loved one will be dead by the time I come back. This magical thinking is extremely distressing. In fact, most people don't even talk about it. They think that ये normal है, या सबको होता है, या इतना degree में सबको होता है. Of course, somebody's sick, we think about it, but not to this much degree all the time. That's when it's an obsession. There are also sexual themes of obsession sometimes, which are extremely disturbing to people. There are people who get sexual thoughts that what if I hurt someone sexually, or what if they get sexual thoughts and images of a dear family member, which is obviously right. Right from the childhood we've been told it's wrong that to think of sexual thoughts of a close family member, and that's an extremely distressing sexual thought. Other obsessions could range from feeling extremely religious, being a perfectionist, And one which really is bothersome for those people who live with the person with OCD is seeking reassurance, meaning they will keep asking you again and again, बार बार पूछते रहेंगे, मैंने ठीक बोला ना, सही किया ना, अजीब तो नहीं किया ना, ठीक था तो, अच्छा ऐसा करने से ऐसा तो नहीं हो जाएगा, until you keep saying हाँ ठीक है, yeah it'll be fine and it's okay, they'll be fine. The moment you don't reply back, they'll get extremely frazzled. But you have to keep on answering them back. That is their compulsion. That is their reassurance seeking or obsession and compulsion loop. There are other obsessions also. One of my clients had a word checking obsession. This is again fairly common. A lot of people keep on breaking down words, breaking down numbers, breaking down algorithms. A lot of people keep checking that when they're talking, are they making sense? And they keep thinking, am I making sense? क्या इस person को समझ आ रहा है? Now once in a while we all do it. I said it right at the start, a disorder is only something which starts affecting your day-to-day life. It starts affecting most of the parts of your life. Once in a while, everybody thinks, dala check kiya ke nahi, gas check ki ke nahi, fridge check kiya ke nahi, band kiya ke nahi. So all of these are normal if it happens rarely or, fairly only during periods of stress. But if it happens frequently, you would want to see a mental health professional. Now, having said that, itna bhi common nahi hai. It happens about 1 to 5% people. I would say about 3 point something percent of people. However, so many people don't talk about it. I feel that when it comes to OCD, we all feel shy. How can I talk about a sexual thought? How can I talk about this blasphemous thought that I'm getting? How can I get the thought that, whether it's a negative spiral loop of something which has happened in the past, which we aren't letting go of. How can I tell them that, when I get off the chair, पहले मुझे left पैर touch करना पड़ता है, फिर right पैर touch करना पड़ता है, फिर मैं बैठ जाता हूँ, फिर से right पैर touch करना पड़ता है, फिर left पैर touch करना पड़ता है. Those are also obsessions that we've seen. So there's a whole range of obsessions. Sometimes obsessions can also be on a spectrum of maybe just skin picking or, just hair pulling. We call it trichotillomania. I'd love to talk about trichotillomania one of these days. So obsessions can be a variety of obsessions. So please know, हाथ धोना, घर को साफ करना, furniture arrange करना, cushion arrange करना is not OCD. You like things a particular way. I'm happy for you. What's interesting is that OCD also comes in two broad categories which we see, with insight and without insight. Meaning there are people who say that yes, what I'm doing is excessive, I want to stop. Versus there are people who say that, hey, theek hai, so what? It's okay. So recently a woman told me that I'm keeping the house so clean, and she was spending 1 hour in the washroom each time she was going to the kitchen to cook anything. Post that she would, so 3 times a day into 3, and then each time she would go to the loo, and each time she would go to just wash her hands after a meal, 1 hour that time. So she was in the washroom washing her hair 5 times a day, 6 times a day, which is a lot, right? But her defense was that I'm only keeping myself clean because it's Corona Kal, and Corona times you have to be clean. But this is where the insight versus no insight part comes in, that some people realize it's too much, whereas other people don't realize it's too much. Some people realize that it's not under their control. Other people think that, nay, I can control it, I can cut back on it. Certain people get obsessions, particularly by triggers. For example, when they see dog poop on the road, मतलब dog का potty देखा या फिर रास्ते में गंदगी देखी, सिर्फ तभी होता है. One of my patients used to say that when she walks on the street, once what happened, some real dirty water fell on her. किसी ने पानी फेंका बाहर से, balcony से, and it fell on her. And ever since that, she feels when she walks close to the buildings that somebody will again throw water on her, and her clothes will be soiled, and she'll have to go home and wash them. So because of which she avoids. Hi, if you came in late, we're talking about OCD. I'm sorry I can't put in the topic for some reason, but we're here to talk about OCD today. We're trying to create some awareness about OCD. So as I was saying, this particular lady would say that, I can't walk next to buildings, and that used to cause a lot of distress, walking and looking up, and that's dangerous, right? Having said that, obsessions and compulsions are also something which, a lot of us in day-to-day life face in general way. So when we are kids, certain obsessions are considered okay, meaning magical thinking that what if my parents don't come back and I'll be alone is considered normal. But if it starts becoming a part of your life very regularly, then it's a problem. So OCD can present in small children also. That's what I want to highlight. There are parents who bring their children to me and they say, तो बच्चा इसको कैसे हो सकता है? Please, I keep saying this on my channel all the time, that mental health doesn't discriminate, then why do you? So OCD can happen to young children. I've seen children as young as 5 and 6 with OCD. There was a kid who used to particularly get this image, and he would have a compulsion of closing his eyes and opening his eyes, closing his eyes and opening his eyes, because he used to say that, there is an image which just flashes every time, and it was a very gory image. So it took us some time to understand, because with kids, with little kids, it's so much harder to make them talk about what's happening inside their mind. They speak in a very different manner. So we play with kids, we make them draw, we kind of try to talk to them in a very, friendly manner where they don't feel scared. So with children, yes, OCD can happen. In fact, OCD can happen in very old age as well. So some people have never had OCD throughout their life, but then suddenly when they're 60 plus, 70 plus, can have OCD. Now, this lady used to have these sexual OCDs in her elderly age group, 65 plus, and she came to me sobbing and said, "It's blasphemous, how can I even think like that?" And I told her that you are not thinking this. It's the chemicals in your brain which are causing this. So just like, you are not deciding that, okay, today my blood pressure should be this much, or today my blood sugar level should be this much, or okay, thyroid अच्छे से काम करो, क्यों नहीं काम कर रहे? We can't do that. Similarly, your brain doesn't do that. You listen to your brain, because your brain sets out a trigger of neurochemicals, and it decides how you are feeling today. It decides how you react and respond to stimuli. It reacts how you process your OCD and everything else. So OCD क्यों होता है? Because serotonin, dopamine and adrenaline के म्यूजिकल, अगर समझो म्यूजिक में जैसे वेव्स होती हैं, सो इक्वलाइजर को अगर हम ऊपर नीचे करते हैं, सो इस equilibrium में थोड़ा सा गड़बड़ हो जाती है. That's when OCD happens. That's why the medicines are specifically targeting these particular chemicals. That's how we know that these chemicals are involved. So somebody asked me once that आप मेरा serotonin, dopamine and adrenaline check कर दो. Here, take my blood, do whatever you want. And I laughed and I said, no, we still are working on research to particularly tap into that, but we know it through the reverse mechanism, meaning because we give you medicine specifically for this and these chemicals get fixed. That's why we know that these particular chemicals were involved. So it's very interesting how medical science evolves over a period of time. We're constantly trying to develop tests and blood measures and psychological tests to measure OCD better. Somebody asked a question about how to measure OCD. There are scales that you can do to understand how severe your OCD is, but for now there is no medical blood test that you can do to see that OCD है कि OCD नहीं है. Another thing about OCD that I would like to talk about is essentially how many people don't talk about it, and how many famous people have had it for that matter. And there are a lot of celebrities who've come out in the open about their OCD. There are a lot of individuals who just realize after reading about OCD कि oh wait, मुझे भी था. But then there's also an opposite. There's a lot of people who misconstrue that they have OCD while they don't, to be honest. So always check with your mental health professional that do you have OCD or not. Just because you're thinking about your ex a lot, just because you're thinking about exam a lot, just because you're thinking about specific topics a lot doesn't mean that you have OCD. Now, coming to managing OCD, who do I see? A lot of people worry about किसको दिखाएं जब OCD हुआ है. ठीक है, पता चल गया है OCD है, अब तो इंटरनेट पे लिखा हुआ है ना. Google is a great doctor, I feel. So Google is good and bad, because it's great because yes, it can show you all these videos, it can show you all these symptom lists, and it can help you understand, help you find community. It's bad because so many people start overdiagnosing themselves. So good and bad. Google and Googling excessively is also an obsession some people develop for that matter, when they have these health preponderance issues. So coming back to how to manage OCD, who do I show? That's a question I get asked a lot. Should I go to a neurologist? Should I go to a neuropsychiatrist? Should I go to a psychologist? Should I go to a counselor? Should I go to my general physician? I'll say go to anybody to start off with. But ideally the protocol should be to go to a neuropsychiatrist who can then assess how severe your OCD is, and based on that formulate, and also he or she can decide whether you have any other comorbidities which are rendering OCD or not, whether you're on any other medicines which can be causing OCD, whether there's a family history. There are a lot of factors. But a neuropsychiatrist would be the right person to guide you that what kind of therapy should you go for, what kind of medication is right for you, whether you need medicine also or not. Not every OCD case needs medicine. I must say this. This is a wrong notion that everybody with OCD needs to be medicated. Not at all. So again, based on mild, moderate, severe, how distressing it is, how big of a challenge it is in your day-to-day life, can you manage it? Can you manage it with therapy? We decide whether you are a candidate for medication or not. Once you decide, okay, I'm comfortable with XYZ doctor, you must keep in touch and start therapy also. Always add on therapy for OCD. I think it's a great thing to learn how to manage your OCD. Now, one question I get asked a lot about OCD, and I'm going to be such a bad person to say this, but I'm a realist. I'm an optimist, but I'm also a realist. And I don't like to sugarcoat the truth. But when people ask me, can OCD be cured? I like to use the word that cure is not a good word. Simply because cure means to never have it again. And OCD is notorious for being precipitated when there are stressors. So why does OCD happen? Let's talk about that. Now, for something which I do in every video or in every IGTV, I think I have to buy a triangle and put it somewhere above my head. But everything has a biological, psychological, and a social cause. It's a amalgamation of these three factors which causes or precipitates a disorder. So biologically speaking, I told you that there are chemicals in the brain involved. Also biologically speaking, your genetic history matters. We find a huge amount of genetic linkage in OCD. So if somebody else in your family also has OCD or any psychiatric illnesses, there are chances, higher chances. So we usually ask like, okay, what's your mom like? Or what's your dad like? Are they also very particular? And a lot of them say, yes, yeah, my mom also does this. So it could be possible for the genetic linkage. There's also always hormonal causes. Some people's OCD is only triggered during certain times of their life. So based on whether it's pregnancy or whether it's post-pregnancy or whether it's menopause or whether it's, for men, certain other chemicals or hormones, we look into that as well. Drugs can also cause OCD. Yes, cannabis can induce OCD in some people. People who already had a tendency to maybe eventually land with OCD, cannabis can unmask it. So I'm not saying only cannabis particularly, but drugs in general. So alcohol also can unmask it, and for some people it's the other drugs. Now coming to the psychological causes, another question that I get asked about is what kind of people get OCD? People like you and me. Never think that weak people get OCD. People like you and me, I can also get it tomorrow. Literally, I keep telling people this all the time, that anybody can get it. But yes, certain people who are on the anxious spectrum, who get who are in a perfectionist manner already, have a higher chance of landing with OCD. So OCPD, anxious, avoidant, they do tend to have higher chances. That doesn't mean that only these people will get OCD. How you sort of deal with stress is another part of your personality, and that's the second part. So biological, psychological, and social, these are the three parts. Now the third part is the stressors, the social. In COVID initially, when it was told that we should wash our hands, didn't we all obsessively wash our hands? So you can see that somebody who had a preponderance for looking at dirt everywhere now obviously must have gotten really heightened. So COVID did precipitate a lot of obsession for people. I'm not saying that all of them were unhealthy, some were healthy, but again, if you're washing hands for about 5-6 hours a day, that's not healthy. That's really not healthy. Now, stresses are another thing. Sometimes the death of loved ones, sometimes failure, sometimes a breakup. All of these can lead to OCD. But again, you need to have a genetic preponderance or a neurochemical imbalance and a personality and a stressor, and it's usually amalgamation of all three. Very rarely do we find two. We do find 2 out of 3, but one itself is lesser for sure. Now, when I was coming back and saying that I break the bad news that OCD cannot be cured, it can be managed. I'm using the word managed. It's not a bad word. It's a good word, which means that you can learn how to deal with it. You can learn how to control it. You can learn how to reduce it. But to say that it should become zero is very few cases. Now I'll share an anecdote which I share with almost every OCD patient of mine. And if you're here and if you are under my treatment or were under my treatment, especially for OCD, you'll know that I've shared this with you. But this is a real life one. Now I don't like to divulge any names, but this is what I've learned with my journey of treating OCD over the last 8-9 years now. How much OCD gets treated? That's a question that I get asked. So when somebody comes in the first time, my job is to set their expectations. That's called expectation management, meaning I tell them, look, we'll fight it, we'll overcome it. How much you'll get better, I'm not sure if it'll be 100 or 100. We can reduce it. Maybe you will get 70% relief, maybe you'll get 50% relief. And mind you, everybody on day one says, हाँ डॉक्टर साहब 50% भी ठीक हो गया तो मैं more than grateful हूँ. People lie. People say that they'll be happy with 50 to 60%. The moment they're better 50 to 60%, they come and they tell me, ये 40% क्यों नहीं जा रहा है? And then when they're 80%, they say, ये 20% क्यों नहीं जा रहा है? And that produces so much more stress, and that produces more cortisol, that produces more, adrenaline in your body. And trust me, most people who hit that mark and are not happy usually go back the scale and start saying that, oh, I'm not getting better anymore. This is a combination of medication, therapy, lifestyle, everything that I'm telling you. But here is my point, that expectation management is a very big part of OCD management. Meaning, there'll be days when your OCD will be very bad, unbearable. There'll be days you'll not even look at your OCD and be like, hai to hai, doesn't matter. But that's what you need to learn from your therapist. That's what you need to talk to your psychiatrist about. That don't go with this 100 on 100 mentality, because that is so stressful. If your OCD can be managed anywhere between 50 to 70 to 80%, you're lucky. You're gifted. I mean, you should be grateful to God. And I would be grateful to God that, okay, I can help you with the 50 to 80%. The last 20% is really something which we don't predict. Now, I'll share the anecdote of two people that I have worked with. Two of the people that I believe had the most severe OCD in amidst all the cases that I have seen. Of course, I've seen various severity, but as a doctor, I feel their cases were quite severe. One was a lady who was very severe, to the point it was very hard for her to venture out of the house. In her own house, she had to touch the switches twice, and with somebody else had to switch off the light for her because she felt that the switches are also dirty. The other was this gentleman whose OCD was also very severe and more of the sexual OCD, and I felt extremely that it was a hard case to deal with. I told them both on the first day that, look, we can try, and 50% would be great. And both of them said, yes, 50% would be great. Doctor, I'll be grateful. And I said, okay, let's bring it on. After about a year and a half journey together, the lady got better 99%. These are not my scales, her scale. I asked her each time, how much better are you? One time 40, then 50, then 60. We came up till 90, and then this one day she said, I'm 99% better. And to me, it was almost like, wow, 99% is great. And the gentleman said he's about 90 to 95%. And I said, wow, that's great. Here comes the difference. The lady got very upset with 99. And she said, I'm very perturbed that why is that 1% OCD not going away? And I said, look here, you've gotten better 99%. How much more is needed? Like 1%. We all have issues 1%. Let's make peace with it. And she was fixated. No, I want that 1% to go away. Otherwise, this 99 is useless. And I was very kind of stunned and surprised. And the guy said, with 90-95, I'm good. I'm happy. I'm okay. This is good enough. I mean, I never thought I'll get this much. Lo and behold, the lady with the 99% recovery actually went into depression because her expectation that 1% OCD wasn't going away was starting to eat her from inside. And that is what life is about. That is what life is. Expectations need to be managed. And in OCD particularly, I don't mean only OCD, but in life generally, we need to look at what we have versus what we don't have. And if you have been battling OCD and if it's better by 20%, 30%, and you're working with a therapist, you're working with a doctor, please try to continue working on that journey. You may hit that 90%, but you may hit that 50%, but try to be content with it. That's a request that I try to, that's a bridge I try to make on the very first day when I sit and evaluate someone. And it's an honest promise I make with someone. I don't like to make, oh, sab chala jayega, 100% theek ho jaoge. Because why should I promise you something which is hard, right? Which is probably going to happen or probably not going to happen. Another big part of treatment of OCD is therapy. Now, all the therapists in the room, shout out to you. You two guys do a great job. I try to do my fair share of therapy in my clients, of course. Uh, what kind of therapy works? Now, based on your OCD or your obsessions and your compulsions, the right therapy will be chosen by your therapist. So some people randomly look up on the internet and say, "Mera ERP kar do, mera ye kar do, mera exposure kar do, mera ye kar do," and I'm like, okay, you know what? You can't just choose like that. It's not a cake that you can pick in the shop and say, "Ye wala chalega mere ko." So when it comes to OCD, let your therapist take the lead. Trust them. Trust them how you would want to be trusted. That's something I say to people all the time. Trust others the way you want to be trusted. And let them guide you through therapy. Therapy is a slow and steady way, but it's very fruitful. The ones I do therapy with, I teach them a fair amount of thought stopping. We do CBT, we do hierarchy of our fears, we do some ERP if it can be done in a particular kind of setting. There are a lot of therapies that have been done. There's tapping, there's so much in the therapy world, and it's always evolving. Let's talk about newer advancements in OCD. There are a lot of new things which come out in treatment of OCD time and again, since it's such a difficult thing to live with, right? So medication is one. I'm not even going to talk about medicine because doctor medicine ke bare mein baat karna those days are, something you will find very boring and mundane. The second part is therapy. There are newer advances. So in newer advances, the ones I want to mention is something called RTMS. RTMS is basically this thing you put on the brain. No, it is not shock therapy. Before you leave, it is not shock therapy. But there are these particular electrodes. You stimulate particular parts of the brain. That's called RTMS. I got training in NIMHANS once, and it works really well in resistant OCD. Not every OCD case, but resistant OCD. There is also ECT. It works in OCD. Again, a controversial topic that I will talk about once, electroconvulsive therapy, since so many people find it bad or not good or sad and whatnot. But we'll talk about ECT another day. The third part of the treatment, which I want to focus upon, is so this is how my algorithm goes: 33% medication if you need it, 33% therapy, mandatory, no options, and the 34% remaining is your lifestyle. You have to change your lifestyle. There is always something that your lifestyle can do better on, and in OCD also you need to kind of overcome certain hurdles on your own. You need to take care of your mind, you need to take care of your body, you need to take care of what you eat. You need to eat cleaner, better, healthier, whole foods. So these things are as important as just not only medication, not only therapy. It's you, because you live with yourself 24/7. And finally, obviously, doing the things you learn in therapy. So many people learn stuff in therapy, कभी घर जाके नहीं करते हैं. And I tell them, ये क्लास थोड़ी ना है जो आपने यहाँ पे पढ़ाई कर दी और फिर घर जाके भूल गए. तो आपकी लाइफ है, and लाइफ में तो हमें constantly करते रहना पड़ता है, right? Now, coming back to some of the questions that I got asked about OCD, there were some really good ones, and I want to pick those up. Can CBT help? Yes, CBT can help. Because it will help in anxiety also in general. So OCD with CBT is definitely something your therapist will recommend. Can you repeat your triangle? Biological, psychological, and social. These are the hallmarks of pretty much any disease. Great info. Thank you, Dr. Chinmay Barale. What is HOCD? I'm not sure what HOCD is. Please do enlighten me. My dad has BP issues. Lifestyle change. The urge to wash our hands regularly, at least when we have some oil on hand, also comes under OCD. So this is a good question, meaning that, so if your hands are dirty and sticky, you will want to wash your hands. That is not OCD. You washed your hands and you look at it and go like, okay, abhi bhi ganda hai. You washed it again, you again look at it and you go like, abhi bhi ganda hai. That's when it is excessive. Washing your hands once or washing your hands when it's dirty is not OCD. New mothers love to become very obsessive about their children's cleanliness. They keep thinking, ganda haath muh mein chala jayega, bimar ho jayenge. No, not true. So new mothers get a lot of OCD because of the fear that if the child falls sick, what if the child will eat something from the floor? Of course, if the child eats something really bad and dirty, the child may get sick, but please know that God has given them a better immunity than we think, and children can touch dirty things, and my little one touched everywhere when we were traveling this time. And obviously, as any other mother traveling in OCD, I was realizing that, I was like, okay, मेरे को OCD होता तो मेरे को really सब flare up हो जाता है. And I realized that only because I know that children will do this, that children are notorious for touching, and I know that obviously COVID can happen, but yeah, with kids you have to make peace with that front, right? So no, washing your hands when they're dirty is not OCD, please know that. What are we talking about? OCD. We're talking about OCD. Purpose of our life. That's an existential question. I have a very good existential answer for it, but another day. Any other question on OCD? Can OCD go away? I answered that. I try to answer that to the best of my ability. How is OCD caused? I try to answer that as well. Any other questions on OCD? Always feel free. OCD is a type of anxiety. Yes. OCD is a type of anxiety. It falls under the spectrum of, anxiety disorders. I got the answer. What you said. Homosexual OCD or HOCD. So yeah, I lost everybody for a moment. So HOCD or homosexual OCD again. So that could be another sexual OCD that we were talking about. That whether checking your sexual orientation or whether having this constant fear that what if I get attracted to the same sex? That fear itself, but not actually being attracted. So that is a subtype of sexual impulses in the OCD spectrum. But I've not heard of HOCD as a term. I'll probably check it out if this is something that is new or it is updated information. Another OCD that I didn't mention was counting. So some people count number of times, specific number of times, that मैं 5 times ऐसे करूँगा and then I'll feel better, or मैं 40 times ऐसे करूँगा and then I'll feel better. For them that is very hard to manage, and of course it takes away a lot of your time, doesn't it? So one of the ways that we find out how bad or how severe your OCD is, amount of time that you spend doing that particular thing. So if you're spending 0 to 1 hours, if you're spending about 4 hours, if you're spending 8 hours, more than 8 hours. Yes, there are people spending more than 8 hours on their OCD also. They become homebound, they can't get out. In fact, there are certain cultural things which are there related to OCD. So there's a terminology called shuchi bai. If you're Bengali, you'll relate to the word. But shuchi means clean and bai means lady. And shuchi bai is a terminology. Typically, it used to be used to denote an elderly lady who may be widowed or who may be staying by herself, wearing a white sari and constantly cleaning the house all the time. This is how the word came about, but it's also called the Shuchipai syndrome. We used to be asked this in exam, I remember. So yeah, that was all about OCD. My mom seems to have OCD. Can my reaction to her actions help her anyway? Let me tell you what can not help OCD. Now this is an information I'm glad that you picked up. Something that I say to the caregivers of OCD, meaning जो लोग साथ में आते हैं, चाहे वो उसकी मम्मी पापा भाई बहन हस्बैंड जो भी हो, I tell them not to give constant reassurance. मतलब certain people when they have OCD, they'll do something and they'll ask, ठीक किया क्या, अच्छे से किया क्या, is it clean or not, can you check the door or not, and they proxy make you check or they make you reassured. You can stop giving reassurance. Now you will have a fight, I know, and I tell the husbands or the wives and I tell them मेरा नाम लेके करो, but seeking reassurance is in itself very obsessive and compulsive, and it's a pattern you need to break. So if you don't break that pattern somewhere, it'll just keep going on, and you'll never learn how to self-reassure, which is something you learn in counseling and therapy. You need to learn how to self-reassure and not seek reassurance from the outside always. So OCD has some interesting stories. I would like to talk more about OCD. Craving for chocolate every time is OCD. No, it's just gluttony. You enjoy food. Ma'am, what is the best way to stay happy always, although we are busy in pursuing our dreams? The best way to stay happy always is there is no right way. You should not stay happy all the time. Yes, I'm saying this and I'm going to repeat it. If you never go down, how will you go up? If you've never gone up, will come down sometime, right? So don't go for absolutes. That is a big part of your OCD cognitive distortion, all or none, 0 or 100. So that is something I would really like you to introspect, that can staying happy all the time be actually staying in a la-la land with no problems? It will not give you the motivation to work ever. Problems are a source of motivation to do something, isn't it? So don't think like that, please. And that was all about OCD today. I hope it helped some of you how to stop overthinking. Therapy is a great way to learn how to stop overthinking. Find a friendly therapist, talk to him or her, learn the tools and apply them. Also, I tell people with overthinking, have a worry time, a specific time set in the day where you worry. And it sounds funny, but it works, where whenever you're worrying any other time, you just say like, okay, I'm going to put this down. I'm going to write it down. I'm going to worry in that 12 to 1 period, not all the time. So that's it for today. I think I'm going to take your leave, and that was how to handle chasing perfection. That's another day's topic. I think we'll talk about it again. And thank you for listening in. That was all about OCD. Please feel free to ask more questions about OCD. Have a great Sunday.